I'm John, and tonight I want answers about dental hygiene in the Netherlands. There's no stopping us now because we're live.
John wants answers. Give John answers. John wants answers. Give John answers now.
Check your calendar. If it says May 17th, 2012, then we're live. My guest tonight is Deetrian Meacham. Did I say that right?
You said it correctly.
Awesome. She's a registered dental hygienist with extended functions. I can't wait to hear about that. She's my dental hygienist from Dr. Bouzid's dental office in Cupertino. I saw her today, and she looked at my mouth, and she scraped all the nasty things away. We'll get more to that later.
We gently removed.
Gently removed.
Thank you.
Not how I recall it, but if you've never seen the show before, and you probably haven't, this is like a courtroom drama. I'm the prosecutor, my guest is the expert witness, and you at home are the jury. And it's your job to convict or acquit the topics. We'll be taking your tweets. So, you can tweet us at John Wants Answer. The last S is for suck, so it's missing. So it's only John Wants Answer. And then we'll read your tweets later in the show, maybe about dental hygiene, and then we'll get some questions and answers. So even you can want answers. We have a Twitter contest. Be the first to tweet in and say you want a headshot of me, and then I will autograph a headshot of me and send it to you.
That's cool.
But you're not eligible because you're my guest.
Okay.
And you shouldn't be tweeting during the show.
Okay.
All right. Go to johnwantsanswers.com to see our previous episodes and links to our shows and get t-shirts and mugs. Go to facebook.com, look for John Wants Answers, and like us. Thanks to our executive producers, Lisa Tamaki and Brian Westphal. Tamaki. I'm being told it's Tamaki. I think I mixed up our cards. Oh, here they are. And of course, Nagy says, best show ever. Let's get started. Our first topic, dental hygiene. Deetrian.
Hi.
We're here to talk about dental hygiene.
Yes, we are.
I saw you earlier today.
Indeed.
Let's see the photo of me earlier today at the dental office. That's me. You took this picture.
I did.
For your permanent records, I believe.
I did, with our intraoral camera.
Intraoral camera. So what are you trying to record? Like a history of what my teeth look like?
Yes. We're just trying to see a frontal view of your oral cavity. And there we're seeing the bottom of your teeth. We're seeing underneath your tongue. And you looking directly at me.
That's probably enough of that picture there. Brushing. I've been told I got to brush after every meal, which I think is overkill. Like I brush in the morning when I get up. I brush at night when I go to bed. But I don't brush like after lunch. I don't brush after I have a coffee.
Really?
Right after dinner. How often should I be brushing?
You know, brushing twice a day is optimal. However, if you brush once a day, that basically what you're trying to do is you're trying to move biofilm back and forth once within a 24-hour period. It takes 24 hours for the plaque to form.
Okay.
So if you at least get in there once a day, it's great. But if you get in there twice a day, it's perfect.
And 3 times would be overkill, it sounds like.
Yes, I think that's a bit much.
Flossing. So I floss every night. And then I come and see you every 3 months.
That's right.
And you ask me, have you been flossing? And I say, yes, every day. And then you look at me like I'm lying to you. So my question is, am I wasting my time flossing?
No, absolutely not. with your case, you have your gums bleed a little bit more than some of my other
My
patients.
gums do bleed.
They do.
A lot, yes.
But you flossing is going to cut down that risk. It's going to remove a lot of plaque in between the teeth because when you brush, you actually remove only 70%. You remove the front and the back of the bacteria, but you're not ever able to get in between the teeth. So flossing is a must.
So before I started flossing, when I brushed my teeth, it would often bleed. But since I've done the daily flossing, like for years now, I don't bleed almost at ever. I only bleed when I come and see you.
I knew you were going to say
and you
that.
hack away at my gums.
Because you can only get down 3 millimeters.
Yes.
I get down the rest.
She gets down the rest. How far is that? Like 6 millimeters?
Is it okay for me to say that?
Yes.
Okay, you do have 4 millimeter pockets in various areas.
Is that too much?
It's not too much. It can be maintained because you come in regularly.
When I first came to see you people at Dr. Bazid's medical
Yes.
office, I was getting 8 millimeters. They put that little slider down that measures it, and I was getting like 7s and 8s.
Wow.
It was bad.
You've came a long way.
I've gone a long way.
That's right.
So besides flossing and brushing, what should I be doing?
One of the things that's important that a lot of people don't realize is tongue scraping. 90% of bacteria stays on your tongue, not necessarily to your teeth. It adheres to your tongue. So what we recommend is things as I have, which are called tongue scrapers, and they come in various types. They can be nice and flat so that it doesn't activate your gag reflex.
It looks like a razor.
It does, actually. So basically what you do is you just take your tongue, you go all the way to the back and pull forward, and that will remove most of the bacteria off of your tongue.
Okay.
So that's a good way to help complete with your brushing and flossing.
You've brought some fake teeth with you and a toothbrush.
Yes.
So show me how I should be brushing my teeth.
A lot of people go directly at the gum and brush this way, at the teeth. So what we're saying is that you should hold the toothbrush at a 45-degree angle to the long axis of the tooth, which just means point it down at the gum line.
Right.
You want to gently push down to get underneath the gum level this way.
Okay.
Are you able to do that?
Do you want me to do it now?
Yes, I do.
Are you ready?
Excellent. Excellent. That's good. You've been working with me for a while, so you're cheating, but that's exactly the way to do it. Thank you.
I find...
Please don't give that back.
What's on this? It tastes funny.
It's toothpaste. It's built in.
Oh, okay. Tell me if this is weird. When I brush my teeth, I hold the toothbrush still and I move my head back and forth. Is that normal?
No.
Okay.
Not normal.
We don't want to talk about deep cleaning versus regular cleaning, do we?
Well, I can briefly say that having your teeth deeply cleaned is pretty much the same as a regular cleaning. We just go down a little bit deeper, so it's nothing to be afraid about. But like I said, you have some 4 millimeter pockets. You can only get down at 3 millimeters, so that's when you would come in at a 5 or 6 millimeter pocket, and we'll take care of the rest for you.
So I've had some deep cleaning done where you had to numb my gums and just go at it. Pretty crazy. But those days are behind me.
They are.
Tell me about veneers. What's a veneer?
Veneer, it's like a thin coating that goes over a tooth. So basically, if you have teeth that are malaligned or if you have spaces in between your teeth, the veneer will come over and it will place over the teeth to make them look aesthetically pleasing. They're very easy to do. The doctor that I particularly work for does veneers all the time, and this is actually one of the things that they do in Hollywood, and you don't even realize that it's done. But
I'm practically in Hollywood now.
yes, that's true. You're on your way.
Today you were telling me about Invisalign.
Invisalign is interesting. It's instant orthodontics in a sense, like veneers, but the difference between having braces conventionally and also just using this thin plastic is basically what it allows you to do is it takes an impression of what you have and you are given aligners. And the aligners start as less perfect as you are today. And over a series of aligners, maybe 10 or 12 or maybe a few more, it will gradually become more perfect. So by the time you finish wearing your liners, which you wear about every 2 to 3 weeks or so, you change them, eventually you'll end up to something a lot more perfect. And the good thing about Invisalign is you can take them out, put them in. If you're going to a wedding or need to do anything like that, you can floss.
Floss.
That's really cool. You can floss.
So between 8 months to a year after going on Invisalign, you'll have straight teeth.
Absolutely.
Because I've got a gap in my teeth. I don't know if you can tell.
We can tell.
I understand you've brought along a prize to give away to our tweeting audience.
I did. Ta-da!
This is a teeth whitening certificate.
That's right.
So you can get your teeth whitened from Dr. Bouzid in Cupertino. So tweet us, and the first person to tweet us saying they want the teeth whitening certificate will receive this certificate.
$400 value.
Wow, that's incredible.
It is.
Thank you so much. So now we're going to do our In Excess update. I'm waiting for the music and the graphic.
I'm sure
It's gonna be great.
Absolutely. There it is.
That was worth the wait. I have this actual letter from actual Kirk Pengilly of the band In Excess. He says to me, "Of course we're familiar with your show," in reference to my show here, John Wants Answers. He tells me in June, In Excess are doing a coast-to-coast tour in Australia, a regional tour, where they hit all the small towns that they haven't been able to hit in the last 20 years, since the mid-'80s. And they have a new singer, Kieran Gribben, who they're excited to introduce to the outback of Australia. And then, in a few weeks, or maybe even now, in Hamilton, New Zealand, they're doing a show at the V8 Supercar Race. That's where they drive the race cars through the streets of New Zealand. Crazy. And then Kirk tells the Camden Narellan Advertiser that they have some new songs they're working on. We've got 6 new songs we've written with our new singer, Kieran Gribben. The band plans to start recording their 12th studio album after the tour. So I'm very excited about this, a new album. The last album was in 2005. So maybe later this year we'll have an album. Who knows? They're going to start working on it later this year.
Exciting.
We've got to take a short break now. When we come back, we're going to take your tweets. And then we're going to learn about the Netherlands. I can't wait. See you then. Okay.
Clear.
This is our clear. We're on a break. So they're showing PSAs and stuff on the air.
Yes.
Okay. I have some prizes of my own to give.
Oh, I love goodies.
This is for Lisa
Tamaki.
Tamaki. And we have one for Brian Westfall. For your continued support of the John Wants Answers show, you get John Wants Answers mugs to use at your place of work. So all your colleagues will look forward to watching my show.
Absolutely.
They'll be like, John Wants Answers? What's that? And you'll be like, oh, it's this great show on the internet.
We know. All our coworkers know.
Wow. You're big.
Look, everyone's getting a mug today.
Does this mean I get to keep mine?
Oh, we got tweets.
That's cool.
This is incredible. People are actually tweeting us. Okay. Blah, blah, blah. I'll try to fix it. Let's do here. Line clear. It's flush. This is going to be great. Okay. Can't wait to get these tweets.
5, 4,